Good morning, all. Make sure you watch today's case because I believe you will learn a lot from this case. It was retreatment, non-surgical retreatment of tooth number 18 through the crown and in one appointment. And every single root canal or root canal retreatment or procedure, even examinations, evaluations that I do, I give it 100%. Like, I give it my all. This case, after I did it, I was regretting why I didn't use MTA in the mesial canals. And the reason for that was, the reason why I didn't use MTA was because it was tooth number 18. It was tough to get to the tooth because tooth number 18 is the lower left second molar. Very tough to get to. And so me imagining putting MTA in those canals, I was going to do it. My plan was to do it. My plan was to place MTA in the mesial canals because the apical parts of the mesial canals were resorbed because of infection and inflammation. So I was going to do it. That was the plan. The MTA was ready to go, but I just changed my mind. Like, as I was struggling to instrument the tooth, and I was thinking, how the heck am I going to put MTA in those mesial canals? If I needed to put MTA in the distal canal, it would have been pretty easy because of the angulation. But to put the MTA in the mesial canals, both mesial canals of tooth number 18, because of the angulation and how far back, how distal that tooth is, it would have been very difficult. Very difficult. So I basically changed my mind and I went ahead and obturated with gutta percha. And this case, I lost sleep over. Again, because I take every single root canal that I do seriously. I take my job seriously. I love what I do. And I want to give the patient 110% of me. When I put my name on something, on a treatment or retreatment or diagnosis, I give it my all. Everything I have. That's why when I go home, I'm so drained. I'm so drained, emotionally and physically and psychologically drained, because I take my job so seriously. I give everything to my patients. Sometimes I give everything to my patients and that's not enough. I can't fight against statistics. If the statistics say the success rate for endodontic treatment on a vital tooth is 90% and more, I can't tell the patient that the success rate, I can't expect from myself that the success rate should be 100%. I do expect from myself to make sure that the success rate is 100%. That's why I give it 150% of myself. But then again, we're talking about statistics. And when you look at the stats of these endo treatments, the success rate is 90% and more. For endodontic retreatment, the success rate is, I would say, 80% and more. But it's never 100%. There's no such thing as 100% success rate in medical field, in dental field. Yes, there is. I'm sorry. If you extract a tooth. If you extract a tooth, there is 100% guarantee that your issue will go away. But now you lost a tooth. So anyways, back to this tooth. So I lost some sleep over this tooth because I kept blaming myself. Why didn't I place MTA in those canals? So I made sure that this patient came back, and for his 6 months post-op, I told the girls, call if you have to 6 times a day, because I want to see the post-op of this tooth. Some patients, you call them 10 times and they never respond. But we got lucky with this patient. He was motivated and he came back for his 6 months post-op. And I want you to take a look and realize that if you do everything right, if you follow the fundamentals of endodontics, then what I call gods of endodontics, the gods of endodontics will be on your side. The gods of endodontics will favor you if you follow the fundamentals. If you don't follow the fundamentals, you don't adhere to the fundamentals, then forget it. Forget it. You'll see nothing but wrath of the gods of endodontics. But usually, most of the times, in situations where you believe you gave it your best and you think perhaps maybe there's a chance that the procedure will fail, usually that's not the case. Usually, if the fundamentals of endodontics are adhered to, the gods of endodontics will favor you. So take a look at today's treatment, and I think there's a lot to learn here. By the way, buy this. Hyperlight by 8 Teeth. Buy it. Contact Mickey Lou. She is usually away. She's getting better at responding. If she doesn't respond, just go to 8teeth.com and you can go to their websites and you can see these products, and you can contact the company. Their phone numbers, emails there. You can contact the company and you can ask if they can provide you with the name of a customer representative or dealer in your country or your city, your area. But definitely buy this. This patient was referred to me for endodontic retreatment of tooth number 18. According to the patient, the root canal was done by an endodontist about 4 years ago. A few days ago, tooth started to hurt a lot, and he ended up going to his dentist, and his dentist told him that his tooth was abscessed and the root canal needed to be redone. And patient was referred to me. As you can see, crown here, build up, previous root canal, large periapical lucency here. And you can see actually there is some root resorption there as well. So we talked about options with the patient. Root canal with guarded prognosis, I would have to go through the crown. He may need a new crown. We can redo the root canal, see what happens. About 80% success rate, 20% failure rate, or he could choose to extract a tooth. And the patient decided that he wanted to try to see if tooth could be saved. And that's what we did yesterday, actually. So we went through the crown, removed the gutta percha, and I used chloroform and number 15 K files, but CK files. They're stiffer to remove the gutta percha. And take a look here. Here's the post-op. As you can see, everything went beautifully. Look at all of the anastomosis between the mesial canals. Look at all of that. That space, we're able to clean it three-dimensionally by our irrigation protocol and activation. Of course, I use 6% sodium hypochlorite, and I activate sonically and ultrasonically. and we're able to obturate, as you can see, in one appointment. We did the root canal retreatment, the whole procedure, in one appointment. Took us about an hour. And again, as you can see, everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. And in this angulation, you can see, again, all of that anastomosis between the mesial canals, and you can see a really nice lateral right there. This patient was referred to me 6 months ago, as you can see, by his dentist regarding tooth number 18. Patient was in pain. According to the patient and his dentist, the root canal was done by a traveling endodontist who had come to his dentist's office and done this root canal for him. So this root canal was done by an endodontist 4 years prior, and patient recently had started to have symptoms with the tooth and gone to his dentist. His dentist examined the tooth and referred the patient to us for examination, evaluation, and possible endodontic retreatment. So take a look here. All right, so you can see the porcelain crown here, build up, previous root canal. Again, this root canal, when I saw the patient, patient told me that the root canal was done 4 years prior by an endodontist. Then you can see a large periapical relucency here, and some apical root resorption also, as you can see. So we discuss options with the patient. Either he could choose to try to see if he can save the tooth. I would have to go through his crown, so he may need a new crown. Redo the root canal for him, and we'll see what happens. Or he could choose to have the tooth extracted, and patient wanted to try to see if tooth could be saved. So that's what we did 6 months ago. Went through the crown, removed the buildup, removed all the gutta percha, and redid the root canal for him in one appointment. So if you're still not convinced that one appointment endodontic retreatment works as well as, or even perhaps maybe better than, multiple appointments, stay tuned. All right, so take a look here. So as I said, we went through the crown and redid the root canal for him in one appointment. And here's the post-op. And here is the date, as you can see, 6 months ago. Let me show you a different angulation. Again, you can see the periapical relucency here, and to a smaller extent here. And this is another angulation, another angulation, another angulation. All right. And again, 6 months ago, when we redid the root canal for him. All right. So patient came in today for his 6 months post-op. He still has the crown that I went through to redo the root canal. The endo axis is restored with composite. And take a look here. 6 months post-op of tooth number 18. As you can see, that huge periapical relucency is almost completely healed. Patient has no symptoms. As I said, he still has the same crown as I went through to redo the root canal 6 months ago. And here's the date, as you can see today. 6 months post-op of tooth number 18. Again, we redid the root canal in one appointment. Let me put the x-rays next to each other so you can appreciate. That's before endodontic retreatment. That is today. Let's put them next to each other, side by side. And here it is. So 6 months ago, before we redid the root canal, and that's today. So here it is, endodontic retreatment of tooth number 18 in one visit through a crown with 6 months post-op. That shows very good healing of that large periapical relucency. So no need in these cases, majority of these cases, no need to do multiple appointments, retreatment. One appointment works just as well as long as the canals are dry before obturation. You can go ahead and obturate. So 6 months post-op of tooth number 18.